Hello, Ebusia. Ubia mo te sen. Ya san ba bio. And na ye say, why do we talk? I didn't kra na ye mu bebre, ye de ye hu asi ho na ye ba social media. Ye Ghana fo ye tutu kwan. And ye ba social media ye be kasa. I didn't na ye kasa. Ebusia fo, I hope so bia ho ye. Ebesi ye bisa ye disa ankomo ketua we ye bisa say adenti na ye kasa because empre pi no niame bi sisi na udi hu nkomo a na Ghana fo no a ya yesi ye na Ghana de sa na tie na Ghana sa na tie enti adenti na ye kasa se Ghana sa na tie na sa na ye pene dia na ehu hia say ye betena se na ye kasa na busua ye ti Ghana ena ye nyina nyame ye yadom ye mu bi no ena ye dom ye tutu kwan na san se ye tu kwan ya ekope nimdie na ye tu kwan ma ye ni bi enti ye mu bi ni ye tu kwan no ye hu se niam bebre wo wa Ghana can do better ena Ghana can do it but ye mpenifo ni de esie yen Etina ye mubi na ye nye pese minkuminya no na ye pese ye nyina as Ghanaians ye di ye ho both home and abroad no ya na ye betena se na ye kasa ebusia why are we talking, why are we making noise and calling for change abra na ye kufu ado woso no nipa ahina na ewo internet so ententine so e kasa calling for change everybody ene yesisa aben mu no bebre na atiada we ya be jonku ye me ya ekufu ayi na mahama ba ye de bebre jonku ye omo ya omo mu jonku ye omo ya omo sisi achia omo pa ebu in fact ha dream do we really want a true change? Were we calling for a true change, a lasting solution to some of the things that cause Ghana? And internet so ye hu niam bebre ekoso with healthcare ni ade ebusuya eya asefem na se wetu kwan na wa ba brochire na hu sene ya healthcare tie na nipa omo ye healthcare workers no ye twa omamoja wo mu but they are disciplined to give you comfort, they are disciplined to give you my friend is saying to make you feel say it is going to be okay, you are going to be fine. Adentina yentimi enhwe say ye kuro Ghana nipa na egu wonti we can ask the same thing for Ghana for niema bebre na ekoso ye pesisaye entina ye kasa enti mam ye yiyimu sasem bi ba na Ghana de sa na ti Ghana de sa na ti and we are not calling for change, we are not calling for true change. We are not calling for true change. See, you're calling for true change. The day baba, Yebeka, Koko baba, Yebeka, because we want a lasting change for Ghanaians. Ye tutu kwan. Ye hu se empenifo bi de nhihye ye tu kwan mu. Asemu si a empenifo yusu ta asem no agina so eye nhihye ye. No mama yasesa ne memu se ne be ya citizens no ho beto mo. Enunti na ye ba ni ye bekasa se nipa na di Americans so se nipa na di Europeans so se nipa na di Asians so na omo come animu a and know there is something wrong with us, especially as Africans, because we share around the globe the same thing na ekoso because ye mpenifo ni hu say ye nipa ye hoso na ye timi kebia we will not give them that honorable yes no we will not give them until ye the BBSA. But ye na ye too kwan no ye who difference, so we want that change in Ghana. Eunice
abusia for ye chiamo mo hey ye wa hey ni se mo so mo ye you know what can ni na the only reason the number one reason why people travel is because they want to change. They want something new. They want something different.
Yeah.
And the only reason that there is the word freedom fighters, and I say, yeah, freedom fighters, is because there is something that is hindering freedom to a people, and they need people to stand up to speak for them. The only reason why there is the word advocate is because there are people that need somebody to speak up for them. That's why all those words exist. And when it comes to play, it's because change needs to happen.
Yes.
And to say, yeah, you too quiet, said the entire most of us you too quiet because it's the same. We want something different. We want something new. And when you leave your comfort zone to go to another setting to find something else, when you go there now, you go and you learn. You have to go and learn. You just don't get up and go and while away the time without learning, without observing anything. You have to learn something. You have to come back with something different. You have to come back with something new. Enunti na yenya nyame yenya dom ehira yen ma ye figa na kromu no. We could say bia we came on our own and I said, but that's how nature works. But even when we came on our own, but when you leave a country to another country, the only thing that might different is say you learn something, you change something. If you carry the same behavior, the same subaya with Timu or Ghana, but now you practice the same thing, then why didn't you stay there? Because nothing has changed. You have wasted your time. And to say, can say, Ghana, there are certain things that needs to be changed. And we are talking. Now who can say, Ghana dear sanet here, Ghana dear ancestor, Ghana dear, then why are we wasting our time? Why does those words advocacy, freedom fighting, then why are those words exist? Because something needs to be done. Because titino it happened. Something happened. And we are saying we need to go as the world changes. We need to change. Abuebia a friend chameleon. Chameleon what way? Baby a obekwa kodru bia there was so sesam no this no eye pe or adapt that environment no na ohun said some change aba yentimi ntina abrochire na ye enjoy good health care na ye enjoy those days no na omo no omo enjoy. People fought and and we know say fighting for a change and it takes time, but we need the people that are fighting also to be on the same scale, to be on the same understanding, and I said the same side. Senior Beya, we watch forward and call for a change. Ghana healthcare system is something that is a cake. It has been there for so many years. The same practice. We are seeing why don't we want a change? Why don't we want something new? Why are we so comfortable? Say, this is how it is, so we should go with it. Why can't it change? Those days in Ghana, no, you didn't tumabo yemu near there, and then rimu, why they didn't tumabo nimu? Why they a qua bontina? We all, because we are learning, we saying things. Even the people in the village, when they come out to the city, they adapt to the city. They behave the way at cities, almost behave the way they dress. They see the difference. And you say, oh, we're Ghana, and you know what to Broche, and you go back to Ghana and want to practice the same thing now. And then because when you leave an environment now, you have to affect change. You have to learn something new. You have to learn something different.
Too much.
I was say we share bibi fufro. I was say we share niama fufro. Say ne be ya wo ba obi kra na one ne ti go no be hu say insisan e bi aba. Wo fi ye mu no de bibi fufro aba. That's why we travel. That's why we even go to school. Titi no ya maame no ye be ka say mema ni nko school na ma ni ntin fi no mu say o mu nko school no mu nko sua bibi fufro no mu fa mbra me bo afie. And to see yen penny for omuko school to the point so omu 2 kwan ekọ school ekọ ye esua ade e wo school And then you say no mukosua a they back to affect change in Ghana. Send a be ya best son ya brabo. Ebusia, we need to stop this thing. Send yes, the ready kai no. You starting and now you start was no. There was so many. We were talking because we needed change. We needed change. Say a baby ba no ye can nim or ya de nya a baby obeba no e wo see ye gina. It's like I don't even see the number of people that they used to talk. Said change has to happen. Change has to happen. It takes only a few to understand the fight and to understand the cause of the fight and the destination of the fight. Yeah. Because we are not there yet. Yeah. And change must happen. Change must happen. Now saying need to coach Luba, you know, me who saw your press conference and I borrowed this word or say Sani chakemu aba. And was sense something has to change. Yeah. We can't go the same path all the time. Yeah. Something has to change. Yeah. And change must happen. Yeah.
As a makasa for the Emma kasa no ye kasa say yes sanium because especially ye to coin. And nipa ne wo baby a ye wo no. And nipa ne hwe nipa so America. And nipa ne hwe ye healthcare so America nipa ne hwe so bi wo Ghana. Me kai say just recently me call Ghana na me cousin baako e call Pantan Hospital. Na ye kodu hono no ye fa card ni those 9 years. Now even the situation around the place no ye nyina ye gu as ya omabo tent. Enye tent apata. Ena ti say titita ma ye ko ye de kwala ko we no mabo ni ye benches si ona omo register na ye titi ho. Ena ayarefo sebi omo need attention as psych patients egu hono. And there was one person na onya crisis. Abrantie yi tia mu or the ne ho bofom or sorry or tiwa no sorry no atia mu na ena ayarefo foforo so ti o. There are people who are not having crisis but they are coming for checkup. And then this guy is having crisis because it's like me who say me explaining or what crisis or tia mu or the ne ho hwe fom or tete ne ho. And the nurses and the healthcare workers were sitting there. Now me and me too quine. Now me who say ye wo baby if ye call na call hospital na obi in a crisis a emergency ye wo baby I didn't be call send ye be ya especially when it comes to psych. Send the place will be serene because in more psych problem, mental issues, bebre ya psychotic, bebre voices in this man. So you have to separate them. Now Brante you quine no then the whole bofom no ye not in Crawford na me ho yirami because at the end of the day no or kwako how do I say it? Obe trigger the other people, yeah, and then it will become a chain reaction. It will cause a chain reaction. It will be chaotic, and this is psych. These are people who are depressed, people who have mental issues, people, and this man, excuse me, or to one healthcare workers na afede me te ho me wo yirami na me kasa. Why don't you take this man to a separate place? Why don't na me kasa? Ba uko kasa yebeka say ye too no we abroche na uba but common sense common sense identity na broni e wo common sense na bibini ni common sense. This person can spark a chain reaction or be trigger every one of the side people there. These are some of the things I buy a becker. Send your healthcare workers, any health minister will cause change. And you say, Sanya, need to Sanya, you know. It was bad. A bright say you would me who said, on one psych word na bibi savior. And why you bet me actually the papers me say bibi near Bewana, me I want to man calm it down. But this guy was carrying on, and the healthcare workers were sitting there, and other psych patients were there. na me ho yira me because ma tukwa ye hu say ye nya ne saa enti se me ba na me beka e wo se mutie ye nya ne saa but bi e beka se Ghana de saa ne ye nti ye nka
enu nti na esedua enu nti na ye betimi patient be ko hospital bi owu ye beka se e ha ne ani bibia ye be ye nti fani tukwan kwa another hospital we do one wewu. Every hospital should have a stabilizer. Before you move the patient from that clinic to the next one, you have to stabilize the person. Say na walking, say or whatnot, they were supposed to calm him down.
Yeah.
Medicate him, do something right there. Because I had to say, ube ko daycare. Now kwala ba ko sati so osua. Ube so susana yan patana. Na another one start isu. Na another one na ye chain reaction there ho nyina ye kekekeke.
No be I.
Psyche ti sese na walking. Obi wo ho a hallucination or take voices obebetime aka che onfa bibi mbo obi ube wana entokwa na esi ho eno nti na ye training nurses are professionals to know. We have what we call a nursing judgment. Right there it has to kick in. You have to calm the situation. Calm situation. Ghana, yes, sanity. Every hospital and right you call baby and a madam be all kind of story one. Ne yare home. Or say ni papa ye diabetic. Ne papa no nim ne diabetic no nim so ko crisis mo a ye ka crisis a say yare no e ba be jin se mo a ohu o tinka. And now say be a fan say obi o hypertension, blood pressure. So be stroke here. Or was signs and symptoms. There were signs and symptoms. Obi wo ho timi feeling ni ti dwano, ni ti pino. And also otimi wo say ni shoulder ye tight, ni kwa ye tight. Those are symptoms. Na se nipa no sorry ko hospital la. Baby obekọ no clinic no e was some stabilizing no and some refer no to a specialist. E was some money bibi na calm blood pressure ni down. Papa na kasa sorry dware to ni ntuma ex na ka mu drive ko hospital ho. Ogoju ho no doctor ni say onko Kolebu from Akosomo to Kolebu. Omo ndu ayi Kolebu e na okoma ye. Okoma ye the doctor ni say omo fa ne bra back. Omo de ne ba back, omo say omo also fa ne kose mortuary. These things are happening in Ghana. It is not okay when our healthcare no is in trouble and we have to say it and we don't want to say it. Something needs to be done with our healthcare system. We know it. Everybody has a story. I have a story. My cousin, my papa, my mommy, or your last born, near Odinechi, near me mami dinechi too. Neba ek on him about 7-8 months. Or call hospital, no have problems. Or call hospital, no more yes, no. Omo catch rain say akwala na ewu na doctor ni won't onko fie no bra the next day. These things happen. You cannot do this. It is not okay. Growing mu when say what tormenting mama already telling mama say akwala now what carrying for all this akwala na ewu onfa nkoda no sorry. Not only say akwala na be poison mama no. What mental and what torture no. These things are happening and the healthcare must be fixed. And if we, how do we fix it? If we don't come out and show the stories that is happening there, there is no reason why any emergency room should not have what it takes to stabilize a patient. No way. It is unacceptable.
Manasseh is that Jiza? Sorry, remember didn't ya fache me Joyce that also thank you so much. Munyina mo aye da mate. Mon share ayi ni maye. And send you a ho na yanka. De bia ebe koso. Now you don't know when you will fall a victim to that asamna ye ka we jine mu jinchai no. asama na wo kanana mebe ka mebe mu no nipa na oye diabetic or call hospital and come on checking the sugar because money was so diabetic. One checking the sugar, put na more stabilizing say bia e bi na mo say e low enti mo money bibi crown put na onu na answer ya transfer na kwa koso mo ya anye onya obeko oye high so a mo be money bibi na ba from but this person no apparently died. I will say e bi onya diabetic coma yesi wewu ne de na ko she fridge yen check it. These are things that are happening but ye too kwan no ye hu say yen ye ne sa Utu kwan so usua ade enti usua ade na wo pani yie a wo de beba bebi a yenye ne sa no enti adenti na moma yen kasa se de bia ye sori ne yesi o Ghana de sa ne ye ne dia eni esi ye nyina ye jai kasa but emba ne sa because wo no etuobi hu a etuaduam emba wo nchen te se ne a Ralph call hospital ho a ni say bleeding na all pay attention na akoye chaotic no wo hu say was say oye sa obi heavy that way obi heavy that way because until me say me ye adwuma wo Ghana hospital kakra as a me to kwan na oba bia ba oba bewo ne time aso wa dilate but ebia akwala no nye ready so obeba na nesi ehuri ejina ayi table no so no de nsa esi maame ne yefunu so se opia akwala na beto me gina ho no me kura na me ntu kwa me hu se sa ne ye ne akwala betimi push aba ato ansa maame kura akoma ate ansa na mbe hu se it was a bad thing to do but people are doing it in Ghana. Enti ebia won enye wo nti you don't want to talk about it. Sa psych patients yasema mike at the end of the day omo man so no mo to no meti hoda mahome makoma ye meja omo to no ekowura dan bi mu uko kasa ye be kasa mo abrochefo mo kasa dodo but adenti na abrochefo no baby a enkrofo ye won America no omo di decency hwe nipa oyare omo ma dignity ba nipa oyare ho na Ghana de yenye ne sa adenti na obi jare na okọ hospital a nurse ti metina ho na so ohwe ni phone obubu ni moro oye den o na patient ti ho na okwan akrofo ti me ko hospital ebusia se nye wo a obi yare na ho mete obi jare bi ontimi ne ho yira no na wakọ na senya nurse twemu kwani on care. It is sometimes nipa e de yawo ene niama wehu eneka. If we continue to say Ghana dey sa and Ghana dey cash and carry. Uba America, utu kwan ko Europe enye cash and carry. It pray. Now Bekasa say no. Nipa na go Europe, nipa na go America. They don't do cash and carry. Enti mama yensi same. Enuti ni etu kwan. It was for a reason. Enti na yetu kwan. Enti ya besue bibia mama yen kasa ni yesesem because ye koso sana there will not be a change and you know who here say ye be sorry say ye kasa because there are some of the things now e was say ye ka ebi wo wa ni say ye ka me ti ho no every 2 weeks me tuya almost 3,000 or 3,000 plus in taxes mini pa baako. Enti a month ni mitua be $6,000 and 3,000 in taxes. Ghana, ye took cocoa wa Ghana. How much do we get in taxes from cocoa? Ghana, ye took bauxite. How much do we get in taxes from bauxite? Ghana, ye took oil. How much do we all these monies, what are we doing to improve our health care, to improve the country? To improve the country. Enti mama yent na se ne enye se Ghana de sa na Ghana and abroche ye different. Abroche no nipa. Enye nipa your friend say ye nipa in grades. Ye nipa grade 1, grade 2, grade 3. Nipa is nipa. It is saying Nyansafogu America, saying Nyansafogu Europe. It was saying Nyansafogu Ghana because ye nipa. Ye penny from where to quite. And so this is the time I was see a dear not to health care because we see and two one. You will not say obi I am wrong. Send to wa. Nyama bebre koso wo ye health care. Me di obi call hospital. Ewo Ghana. Na nipa no pompo abonase no ferry. Pompo abonipa ase doc okon ya na ye edura e chro man. Charlie, Eunice, ye kasa too much.
Niame bi e was say niame bi sesan. Sa kofa card bra. Koto
edro UTI edro.
Koto card bra. Koto edro bra. It has to change. Nipana or yare no. First, I was say most money is stable. That is the number one thing. Obi yarina oba hospital. And you are fan yeba suma say uncle toka uncle faka dembra. You have to find a system ebia registration. Obi baba once in a while no abe register nko for no sa no mu ye no abrochire ha.
Omo so mu ye nipa.
Adenti ni nya bi. Kofa card bra. Nipa ni yare bibi ya no na homete. He's not in his normal self. Ye nyina ye te ho no. Ye nyina ye himself. When you are sick, you are not the same person.
Yeah.
Uba di bibi yo, you don't want to be bothered. There's something wrong with you. And ya afi ni ebeka say kofa card bra. Koto edro we bra. We need to change the hospital system. And Ghanaians, where you be and what say you come demonstration po. Because it says in your kaka, you know, and two you don't see what it is. We are in the healthcare and we know how it is when somebody is sick because we've been trained to understand. As a nurse, no, you training woman who tears here, you are at say we are soldier. We are soldier near, you are not a civilian anymore. You are a different person. We are police near, you are not an ordinary person. You have some kind of special training to be different. And next, you've been trained to take care of life. It is very critical. It is very, very critical and important. Yeah, uko ejumem. Nasel, uko take over, now accept here. It means you are accepting whatever comes in the way. And to know se niame bi koso na enye na wan kan na wusoma. Let me tell you something. Hospital management and a CEOs ni ade no. When there's a problem now, the whole hospital will be in trouble. They rather let one nurse carry that problem than the whole management. And you know, nurse you always have to be alert and be cautious. Ukwa ejuma na wunim se niama na akadie na e wose ebua woma wejuma ni di muni ni wa. Don't be quiet because asem sia Ghana na asem sia enko bebia because it's always who you know. But senke kromu ha asem sia one person will take the fall rather than the whole facility will take the fall. And as a nurse, you always have to make sure that you are advocating so that the necessary things that you need to work with. Because oko ejuma na gloves in niho na wo wan kasa na management afa gloves amba obi di kro a aproba. I was say what they want say. You can't tell the person say we need gloves.
Yeah.
Obi ba excuse me. Obi tough from see na say we save life. No, na we need or bleeding. Na say we need akadia wo de beye. Na say one can. You have to do it with your bare hands. You cannot say nipa ningu because the hospital didn't provide gloves. Did you know? Were you aware that the hospital is not providing gloves? And what did you do as a nurse? As a nurse, did you know, sir, the hospital doesn't have gauze to help do wound care? Obi be hospital wana ekuro wana wa. Wouldn't say hospital ni gauze and also ni saline. Insuyo na yade wokro no. And now who as a nurse no, what did you do about it? Because it's your responsibility to take care of the patient. Hospital management, you know, they are not there to take care of the patient. They are not directly in contact with the patient. One nurse, you know, now we are directly in contact with the patient. So you have to know what you're doing. You cannot tell a patient, say, the hospital did not provide something. You are aware. Why are you telling the patient? You're supposed to be telling the hospital management, not the patient. Hello, school na ye kono. What are we learning? What are we learning? It is not your responsibility to tell the patient, and the patient, for God's doesn't care what you have at the hospital, or or by hospital, or by home, because he expects the hospital to have something everything that she doesn't have at home. Or the fear and can by hospital or by hospital because hospital in there was said a what. So why is it not there? And you as a nurse, you were aware say it's not there. What did you do about it? You're telling the patient. You're supposed to be telling the hospital management.
Ebusia, Susie Awuni, I want to say good evening. Ebusia, senior year kano, nurses, those times, Nightingale, when is a Florence Nightingale, those times, you know, or ye advocate, or no, or didn't who see ho, say obe buenipa, and in a hospital, a bar hospital, and it's a woo ye nurse. You are an advocate for the patient. You are not for the hospital's management. You are for the patient. It is a patient baho ne baby ni wa. It is up to you. Say you will fight. Say nyama would be ye ama nipa wa tono nipa wa pomu di be jinem ebe di muno. E was say we will fight it. Now here comes Ghana. Say protocol. Say you girlfriends, boyfriends. Nobody cares about anything. To see Obia sorry, Madam Nurse, and no muje. Where is the caring? Nursing means nursing. You are caring for somebody. So where is the care? You don't have to stand by the hospital management. We are an advocate. We jinemuma ayarefo. It is a niema bi nkoso na emboa yarefo na. You as a nurse na wosa woka. Ukoka say Ghana de okoka ye be yiwedi. Ma yenyi wedi na wanimu benyam. Ma yenhu se wo no wo abadaye wo temama patients no. Because den na hospital setting. Na mwako wasori anopo we dware ukọ akoje ukọ hospital akoye adwuma, which means ukọ je nkwa na niema wo uni niema na odebeje nkwa na ne osori ko koye de.
Why is it open?
Why is the hospital open? And to work with school now, your nurse now call facility be na niema bi wo ho no mu a woni mu say as a nurse ye de boa yarefo na eniwa e was so utimi kasa. E was so utimi kasa. That is why you are nursing. That is why you are honomo. Ebusuafo Ghana nurses and Ghanaians. Muma ye ninda ho. Ni ehu say ye kasa because ye beniye. Ye baby ye because nipa and ye ade ye. Until when you find yourself in a place na nipa ediso niama ye kama. Who say it can be done in Ghana? It can be done. Ebusuafo the yetina sina ye kasa ni ye kasa no. We want it to be fixed. So you are fixing it now. You will go and meet it. So one committee we busuafo bi ben ehifa Ghana ehifa eno efie ba kono ebusuani nyina tukwan ye bo say ye kasa ye maame wo ye miensa ye nyina ye tukwan, but we have cousins. Your men in us, but we have cousins in Ghana. so ye wabusua ni bi wo Ghana enti ankawa ebeka wobusua ni so ye obi a wani ku wabusua wo ye obi a wo nya pesami kumunya wo bekasa because wo ankawa ebeka obi enti abusua mo ye njai say Ghana there saa netie Ghana ye cash and carry there are systems a ye betimi aya enye cash and carry enra me ko dental clinic dental office na me call ye no my trainer my insurance no me renew ye enso me ye emergency a me call ye no omo hwe me they almost share me na omo ni why payment plan omo yeyi won bibia say ye nipa na den hihye to and rather than blaming Ralph and calling all this and making all this noise about Ralph no mama ye ni bring ni health minister no and kasa no nye something different. Said the biana yes one way na or no onye something different. On fine she bia a bit me aboa ama wo nurse no wadwuma be koso. Oh yeah, yes na nurses no omko a omu ni hwe omu de be adwuma. Why are you there? Why are you not talking?
Yes, only a bad nurse works in a bad facility.
Yes,
because you are just as bad as the facility.
Yes,
because if you're a good nurse now, you will want to work well, baby. Yes. Now one bound for so school now who go school now wako jinim dear now the ababe son nipa abra bono who be ye juma wo baby Sanyama na wunya se ne be ya wo be ba mfaso ne be wo ba wo ye bad wo ye motro mojo se kan se nurse ni ntino wo so ye adwuma wo hospital ye bad ye motro mojo mo nje nkwa nkasa wo mo nje nkwa mo kunipa nti wo wunya nurse wo ye owudini because so wutimi ebie wa no ka kire patient se enye wo onkonko bisa ne hospital management that just a woman kasa we are aware say near koso wo but won so no ye bad wo ye nipa bone won ye nurse wo ye wudini ntino what ho e na wo hwe me I don't care so don't tell me say untimi fa wo pay nkonkoto gauze go where there is gauze if you are a good nurse a good facility will hire you but you are a bad nurse you are not a nurse. I'm trying to use what?
So you go with the flow.
Yes.
You go with the flow. You don't care.
Yes. You are a bad nurse.
The title nurse, you know.
You got
fetal because you are not there to nurse patients.
Yes.
You are not there to give life.
Because so there are other hospitals in Ghana. Private hospitals they have everything and they will pay you. It's not for free because government hospital now or near many one. Who you good nurse you have to
you have to stand up for the patient. You have to talk. Your nurses be brain you will need na kasa. That is why you are there. You are an advocate.
Yes.
Senyama nkoso obi wo hono no hospital or gi awo ni bi akwala ni koda form ni ade na wo ti wo na nkasa. You are not an advocate. Nurses are an advocate between a patient, no. Enti ebusuafo mumma se wo feel say the hospital na wo ye adwuma won. Niama eni ho a wo de be ye wo adwuma ma wo so wani mu abenyama. Fi ho wuntimi nkasa fi ho no mo. But you can't just be there. Say anywhere you are there. You are not saving life. You are not adding anything to humanity. Until we see for some we are course we say and two you will just say oh na ye there. But at two we say sana emoya. Until we see Mumma yen kasa na health minister no on Francis Ayembra na ntisaye ba ebeboa me ene wo nyina onyame nhiraye na yensa enhie biom ni ndi ye hu komo eda mo ase Susie thank you Joyce and Manesse thank you so much mambo odini ya afacheme nyame nhira mo nhie videos no na yen nyina yen kyerkyere adwen bye bye.